Now to good health. This came as very welcome and I think surprising news to a lot of people over the weekend. Earlier this year, former President Jimmy Carter announced that he had skin cancer and that it had spread.
Yeah, but over the weekend, he announced that after treatment, there is no longer any sign of that cancer. Dr. McGeorge is here and he has details on the drug that's been used to treat him.
Well, that's right. You know, Devin and Ruth, generally melanoma that has spread to other areas of the body carries a very bad prognosis. So naturally, people are curious about the 91-year-old former president's announcement that he no longer has signs of cancer after only a few months of treatment. It's more than a miracle. It's progress.
Jimmy Carter had not let advanced melanoma stop him from teaching Sunday school, but this weekend, he stunned the congregation when he mentioned his latest MRI.
When I went this week, they didn't find any cancer at all, so I have good news.
Carter benefited from early detection and rigorous treatment that included highly targeted radiation and a new drug.
They had developed a new medicine called pembrolizumab. I want all of you to remember that name, if you will. Pembrolizumab.
It's better known by its brand name, Keytruda. The FDA approved it last year for patients with advanced melanoma who have exhausted other therapies. It works by taking the brakes off a person's own immune system, allowing it to attack more cell types, both cancer and sometimes non-cancer. Dr. Ding Wang is a cancer specialist at Henry Ford Hospital and has prescribed pembrolizumab to patients.
So it is a standard of care now.
While it has not been used long enough to tell what the exact survival rate will be, based on related drugs, Wang estimates
the prognosis for the patient who had a good response definitely changed to the better. We already know there are 20% of long-term survival has been observed for metastatic melanoma. We see the promising results. We still kind of like fine-tune how to optimize the course of the treatment based on the results, based on the safety of the patient.
Now, Dr. Wang and others who haven't treated Carter but are familiar with the circumstances, they all say while there's definitely reason for optimism about his response, there is still a chance of recurrence, particularly for the brain lesions. Nonetheless, this really highlights the breakthrough nature of immunotherapy for melanoma in particular.
Wow. And so what were his chances of survival without the treatment?
Well, prior to this, the average was about 3% over the course of about 10 or 20 years. Now we're talking 20% if you are a responder. So this is really a game changer in the field of melanoma treatment.
Is it more remarkable that he was able to turn this around at his advanced age, or does that not really have anything to do with the way your body responds to the treatment?
Somewhat, yes, because at his advanced age, he probably had melanoma that would have been more responsive toward this kind of treatment because it's more complicated melanoma. It has more funny markers on it that would have been recognized by his own immune system. So oddly enough, his age probably did play a protective role in this case. And the interesting thing here, of course, is because of his advanced age, he is likely to outlive the likelihood of the melanoma recurrence, we hope.
Likely to die of something other than melanoma. Yeah,
exactly.
Wow. Yeah. What news that was when that broke through. All right, thanks, Frank.